right, so what to expect today? So we are going to have three presentations. First, we're going to talk about the role of community-based organizations and what is it that they play in supporting older adults. We are going to have a chat about nutrition risk screening and the upcoming success guide. And then we're also going to talk about how we can work together to address food insecurity among older adults. So first, I would like to introduce our first speaker, Monica Morrison. Monica worked with seniors for over 30 years. Her career started in downtown Toronto with the Second Mile Club of Toronto and ended as the executive director of the Golden Circle Seniors Resource Center from 2011 to her retirement in 2022. Monica's other roles included president of the Alberta Association for Senior Centers, treasurer of the board of the Alberta Elder Abuse Awareness Council, member of the Central Alberta Falls Coalition, and the operations team of the Central Alberta Poverty Reduction Alliance. Monica remains a continuing education instructor with Red Deer College, ASHA certificate program in the area of aging and older adult fitness. Her experience covers a diverse client group, including people with physical disabilities, dementia, and multicultural and LGBTQ communities. Her mission is to ensure all seniors have fun and have a good quality of life for their entire lives. So I will hand it over to you.
Thank you, Jasmine, for that kind introduction. So my presentation is really short and sweet. It's really to kind of get you guys thinking about how you can get involved in your community with your local AHS dietitians, with hospital, with other organizations, to address the issue of malnutrition with older adults. And so the next slide will give you some ideas as to how that is. So why are you so important? Well, because first of all, you're connecting with clients through your, especially if you're in the outreach services, or even as senior centers or the services that you provide, you have the ability to build relationships with the people. You could also, when you're doing your initial assessments with your clients or your members, is ask questions and talk about food and access to food and how they get food. And one of the other things that's really important to note is malnutrition is one of the contributions that why older adults end up in the hospital. So, you know, if we don't ask the question, if we don't explore with the people that we're serving as to how they're getting their food and groceries and having access, if they're even eating. We've often heard the term the tea and toast syndrome. Well, that happens more than you realize. And so, you know, we play a very important role as community-based organizations to be connected with our people. And the next slide also looks at some other things to consider. So some of the things that you can do, and one of the things that we used to do in the Red Deer area is we connected with our local Alberta Health Services public health dietitians. One of the speakers here today is Jennifer, who I worked very closely with for a number of years in the Red Deer community to bring education to our older adults, and she's going to even talk about a project that we were involved in. Find out how you can support some of the AHS programs that they have that looks at food and dietary needs and malnutrition. They have some really good webinar type programs. And I'm sure Jennifer and Tanya are going to talk about those. They've also developed some tools that as a community-based organization we were involved in. I'm not going to tell you what they are because you've got to listen to Jennifer to find out what they are, but really helpful, very easy, not very long as an organization, maybe take 5 minutes if you implement it as part of your assessment process. It is not onerous and very straightforward. And so then there's the Screen 8, and I'm not going to explore what that's all about. Jennifer, my colleague, will say more about that, but that's the tool that we used in our assessment process for our outreach clients, and it was very simple, and it really identified who we need to be concerned about when it came to malnutrition or the risk of malnutrition, and trying to connect them with community support services that will get food to them. What's happening in your community that has food attached? Are there some community-based food programs, a community dining program, Meals to Wheels, or Meals on Wheels, and or bringing people to a central location, or a roving lunch date where people meet in various restaurants. We in Red Deer even established a relationship with our local food bank because a lot of older adults could not get to the food bank. And so, it's just asking the question. Just ask the question and find out what it is that you can do to get people connected to food. And so at this time, I would like to take the opportunity to introduce to you the next speaker who's going to share some of the stuff. And her name is Jennifer Sundberg. Jennifer has been practicing as a registered dietitian for 30 years. She has worked in various areas, including acute care, long-term care, home care, and public health. Her most recently role in nutrition has a focus on older adults. She sees older adults on a one-to-one basis and has also been working collaboratively on malnutrition risk screening in the community, which she will discuss in this upcoming session. In her spare time, if she has any spare time, she likes to walk her dog. She likes to cycle leisurely, listen to old-time radio shows, and spend time with her family. Ladies and gentlemen, please welcome my colleague, Jennifer Sundberg.
Monica, thank you so much. And it is such a pleasure to have you start off this session with us. It's been great working with you over the years. Thanks to everyone also for attending today. I'm so happy you're all here. Before we get started, I also want to introduce my esteemed colleague who I'm partnering with today to present. Her name is Tanya LaRue. Tanya has been practicing as a dietitian since 2005. She holds a master's degree in adult education, which she pursued to understand how to better address food insecurity in Canada. She is completing her PhD studies in kinesiology and health studies with her supervisor, Dr. Elaine Power. Tanya currently works part-time as a healthcare education coordinator for caregiver-centered care with the Department of Family Medicine at the University of Alberta. She also works part-time as a population and public health dietitian in Alberta Health Services Central Zone. Needless to say, she's very busy. She lives with her son, partner, 2 dogs, and 1 cat in rural Alberta. Welcome also to you, Tanya.
Thanks, Jen. Yeah, we wanted to make sure that we had an interactive presentation dialogue. And so I'm going to hand it back over to Jen shortly, and she'll talk more about nutrition screening of older adults, what, why, and how. Then she'll hand it back to me. I'll talk more about food insecurity in Alberta, particularly food insecurity among older adults in Alberta. And then we'll briefly go over some resources. But to get us started, I would like you all to engage with us through Poll EV. So the slide here gives you how you can do that. So you can join on a web browser, either through your phone, or if you have the Poll EV app, you can do that. So to do that, it's listed right here where it's pollev.com/my name, Tanya LaRue 351. Or you can text the number 37607. And in the message, you write Tanya LaRue 351. Sometimes when you text, you get a welcome message right away. Sometimes you don't get the welcome message until you've responded to a poll. So if I can, in the chat, as soon as some people get joined, if you can just put yes, or if you've got reactions, and give a thumbs up, just so that I know we're good. Thanks for writing that in the chat, Jasmine. So I see one person said yes. We're seeing more people joining, and every slide that comes up with polls will remind you how to join again. So let's see if this is working, and then I'm going to hand it back over to Jen. So here is our first poll. How much do you know about nutrition screening? I'm always about to move it ahead and then it keeps moving on me. So I'll count to 3 in my head and then we'll advance the slide. Looks like we've got a crowd that's here to learn from us, Jen. I'm ready to learn from you.
Thank you so much, Tanya, and thank you for starting that poll, everyone. It's really good to know just where people are at when we talk about nutrition screening. So to get started today with my little part on this presentation, I want to do a little case study. This is an actual person that I know, and I want to give you a little bit of details about her. So Tanya, if you just want to go ahead and advance the slides for me, that would really be helpful. So we have a 73-year-old lady who lives in a condo that's centrally located. She's independent. She has rheumatoid arthritis and also COPD, which is a breathing issue. She's on oxygen 24 hours a day. She has had several surgeries on her feet due to arthritis, which makes her walking a little bit difficult. She was recently hospitalized due to a fall, which caused weight loss. She's also on a fixed income. She still has a mortgage. She also owns her own vehicle, and she doesn't like to cook meals just for herself. So I want you to ask yourself, just in your mind, a couple of questions. And I think there's a couple more bullets, Tanya, to jump forward on. Thank you. So ask yourself these questions. What issues do you see that might negatively affect her nutrition? Just think about that. What factors might positively influence her nutrition from what you see? Okay, and what factors don't you know that would help with these questions? So there's probably more to know. Okay, so it does look like this person may have some nutrition issues going on, but is this person malnourished or at risk for malnutrition? A nutrition screen will help to determine this. So we will come back to this case study shortly, but it's just to get you thinking. Next slide, please, Tanya. So we know, first of all, malnutrition starts in the community. Based on data from an agency called the Canadian Malnutrition Task Force, they did a study called More to Eat. And from that study, they found that 20 to 45% of Canadian patients admitted to hospital were already malnourished. As well, the Canadian longitudinal study of aging dataset showed that around 1/3 of older adults are at nutrition risk. So what do we mean when we say at risk for malnutrition? At risk for malnutrition is where intake does not meet recommendations, and we start to see changes in a person, such as unintended weight loss, suggesting that the person is not doing as well as they could be with respect to nutrition. And if these changes go on long-term, it becomes malnutrition. So as you can guess, many factors can put a person at nutrition risk. Some of them are social or economical factors, and others may be more medical in nature. Next slide, please. So there are various definitions of malnutrition, but generally what we see is an individual has an unbalanced nutrition intake. And for today's purpose and in clinical practice, undernutrition and inadequate energy intake, and also inadequate energy or protein and nutrient intake are the focus. Also, with malnutrition, changes in body composition are evident. We see muscle wasting and fat loss and unintentional weight loss. In the long term, there is diminished functional abilities, which can lead to frailty. While there are several definitions of frailty, generally, it is a medical syndrome with multiple causes and contributors that shows itself by diminished strength, endurance, and physiologic function. Being malnourished and frail can lead to functional decline, loss of independence, falls, impaired wound healing, increased rates of infection, increased risk of hospitalization, and even mortality. So interventions in the community focus on improvement in nutrition by understanding the root causes of the poor nutrient intake and devising effective strategies. Nutrition screening can assist with this. I'll speak to you about this shortly. So next slide. Thank you, Tanya. So we have a whiteboard open now, and I want to ask you all, who do you think is more likely to be malnourished when we think of people in the community? So what factors might they have, or what risk factors might they have that could put them more likely to be malnourished? And just to help you out, I'll give you one factor. One factor could be low income. So if a person is lower in income, they are more likely to be malnourished. So I'll get you to write a few things down that you think might cause someone to be more malnourished or more likely to be malnourished. Seeing lots of ideas come up. Thank you so much. And I think you guys are on the right track with your answers. Just give it 5 more seconds. Thank you. So it looks like you have a lot of ideas: alone, mobility, diseases, isolated, single, dementia. I'm seeing lots of things: frail, renters, stress. Thank you so much. So next slide, please, Tanya. So here is a list, and I think you've got a lot of them, of who is more likely to be at risk for malnutrition or to be malnourished. So older adults, education levels less than high school, income issues, being alone, which was mentioned, less social supports, less social participation in events. They don't drive. There could be some depression. I saw mental health on the list. Disabilities, maybe some cognitive impairments. I saw that as well. Many medications or health problems. They rate themselves as being poor health. Poor oral health, so dental decay, for example. They may also be needing more help with adult children for groceries or cooking. We often see people who are on home care or other services that are more malnourished. And the use of ONS, which is oral nutrition supplements, is often a sign. So something like taking Boost or Ensure, those people are more likely to be malnourished. So we do see some of the factors that are involved. So it's important to be aware of some of these causes, and many of them are root causes. And also know that many people have more than one risk factor. So the more you have, the more likely you could be at risk for malnutrition. Next slide, please, Tanya. Thank you. So now I want to turn your attention specifically to a screening initiative that I have had the pleasure of being involved with in Central Alberta, as Monica mentioned at the beginning. It was the first nutrition screening initiative that was initiated in the community for older adults. The screening initiative, first of all, began as a pilot for 6 months with 2 local PCNs. So the Red Deer PCN, as well as Peaks to Prairies PCN out of Olds and Sundre area, as well as the Golden Circle Seniors Resource Center in Red Deer, where Monica worked. The pilot is now complete and screening continues on. Evaluation is also underway with our project. So Screen 8 is an easily administered, validated 5 to 10 minute screening tool, and it's targeted at community dwelling older adults. It helps to identify nutrition problems early on, or what we call upstream. It can be used to identify those who need nutrition education, community resources, or a comprehensive assessment to determine the extent of their nutrition problems. And it can also diagnose malnutrition. Screening can also help keep older adults stronger and healthier as they age. The creator of Screen8 is Dr. Heather Keller, and she is out of the University of Waterloo, and she's also part of the Canadian Malnutrition Task Force that I previously mentioned. I will show you an example of the Screen8 form shortly. So next slide, please, Tanya. So with our pilot project within Central Alberta, I wanted to point out some of the comments that came out on doing screening on older adults with our partners. So the 2 PCNs, as well as the Golden Circle Resource Center, had some comments, and these are recent comments that I've asked them in the last couple of months, what they felt about implementing screening in their agency. So you can see some of the comments here. I don't have to read them all, but generally the comments from our partners have been very positive, and they find it's been a great support. They learn a lot about their clients just by doing this screen. And one comment I like here is that it's a great conversation starter. And I do find often nutrition is a great conversation starter. Everybody eats, everybody has an opinion, and it's usually a low risk kind of topic. So I find it's a great way to get people engaged right away. Next slide, please, Tanya. We also have a few comments that were made by participants, so meaning a person that was actually screened. So the comment this person said was, "It made me realize the importance of nutrition, and if you need help or assistance of any type, that health services are there. It was good for me. It got me sort of on track with my eating habits again, and I'm even starting to put on a little bit of weight. It has improved my quality of life." Next slide. And we also have an older adult advisor that helped us with our pilot. And this was this person's comment. "I've picked up useful healthy eating tips to help prevent things like bed sores and muscle wasting. I recently had my own referral to a dietitian to improve my calcium and protein intake. She is currently working on a nutrition care plan to help me regain my strength so I can continue to live independently." So another great comment. So moving on, why screen? Well, there's many reasons why we want to screen. First of all, it can detect risk for malnutrition. Malnutrition has negative consequences. For example, data available, again, from the Canadian Malnutrition Task Force has shown that 1 in 4 patients are admitted to hospital are malnourished, and many of these are older adults. Also, malnourished patients are 2 times more likely to be readmitted to hospital. Also, a malnourished hospital patient will stay 2 to 3 days longer than a patient who is well nourished, and this costs about $2 billion a year to the acute care system. As well, 1 in 3 seniors have difficulties meeting their nutritional needs. Also, I want to point out nutrition screening ties in food insecurity in older adults by helping to tell the story of what is happening with food and nutrition related issues. Screening also helps to link older adults with supports in their communities. And so best practice is to screen to identify nutrition risk in all settings, regardless of their weight status, and using a validated tool for the setting, such as Screen8. And now next slide. Thanks, Tanya. Okay, now I want to show you the content topics of the Screen8 questionnaire. And you're probably wondering, why do we call it Screen8? Well, originally, Screen8 has 8 questions. But when we did our pilot in Central Alberta, we added on question 9 and 10 because our community partners wanted to find out information as well on financial strain and access to groceries. So Tanya's going to talk a little bit further about question 9 and 10 later on, but I wanted to show you specifically the content that's asked on the screen. So next slide, please. Also, what I want to show you now is some tools that are available for screeners. So screening is really easy. Anybody can be trained to be a screener. You don't have to be a healthcare professional. there's tools ready to go. So I want to just show you a few samples. So next slide. Thank you, Tanya. This is the actual screening questionnaire that we have gotten ready for anybody who wants to screen in their community. So basically you ask the older adults the first 8 questions, and then you total up the score, and the total of the first 8 questions will tell you where they would be in terms of nutrition risk. So they would either be low risk, moderate risk, or high risk. And based on where they are categorized would tell the screener where they could refer them to. There's also questions 9 and 10 on the screen that are not given points, but they do help with helping the older adult in the community if they're having issues financially or having access to groceries. So these tools are ready to go for anybody who wants to screen. Thank you, Tanya. Next slide. Now, getting back to our case study that we looked at earlier. Just learning a little bit more about a screening, a little bit, just a taste. Where do you think this person would be, or what this person would be considered on if they were screened? Would they be considered low risk, moderate risk, or high risk for malnutrition? And Tanya, are people able to fill out that form now, the poll?
Yes, they are. I apologize for the view, so we won't be able to see them, but I think once you submit yours, you'll be able to see the feedback, and in the text, in the chat, I'll say what the most popular one is.
Okay, thanks. We'll just give people a minute or so to just take a guess. Doesn't matter. It's just for information, just to see how we're thinking about this one client.
It looks like moderate, I think, is the top one. Again, I apologize. You try this stuff the day before, and then the view changes. So I apologize, everyone. We're going to have a few polls that don't fully show you the results. Thank you for still participating.
Thank you, Tanya. And you're right. This person did screen out as a moderate nutrition risk, which is a time we really want to catch people in the community before they reach high risk. So when they're moderate risk for malnutrition, there's still a lot we can do to prevent high risk of them being malnourished. So this person had lots of issues. I also want to point out for question 9 and 10, this client also had issues with income, having trouble making ends meet at the end of each month, and also transportation issues, mostly due to the oxygen causing her to not want to go out. Just she got tired easy, and also the walking was very difficult. So not so much that she didn't have a vehicle, but just her physical health limited her. Okay, thank you, Tanya. If you want to move on, that'd be great. So I just want to also point out, we've made some personalized tools for anyone who wants to screen. So this is a tool that's ready to go. The column 1, 2, and 4 are already filled out. So for individual communities, they just have to fill in column 3. And it really just talks about local community services that are available. And then this tool is used, that screeners use to help refer clients on to appropriate resources in their community. So it's just another tool that's ready to go. Also, I want to point out, because we did the pilot, we also have training that's ready to go in terms of a PowerPoint presentation. The PowerPoint presentation is also being recorded so that anyone who is screening can listen to the PowerPoint presentation right online. So it's ready to go. Next slide. And this is my last slide. And I want to point out that all the tools I've shown you, as well as much more, has just been uploaded to the Alberta Health Services website in our newly created success guide. I'm really excited about this guide because it is based on the pilot that we did in Central Alberta. So we used all the feedback and input from clients, from screeners, from healthcare professionals, our advisor, to develop this guide, as well as other internal and external reviewers. So this guide is ready to go, and I encourage you to take a peek at it. Everything is there for you to take a look at. So Tanya is going to continue on, and I'm wondering, Tanya, do we want to stop for questions now, or do we want to wait till the very end? I'll leave it up to you.
You know what, I'm going to, if we stop for questions now, I can deal with the technical issues with sharing the PowerPoint so that everyone can see the results and not just me. And so we can stop for questions now. How does that work?
Okay, I'll take maybe just a couple minutes, because I want to leave time at the end for discussion and for Tanya's presentation. But are there any questions? And Jasmine, if you want to help me out, that would be great. If you see anything in the chat, or if people just want to unmute, that would be great.
You bet. So there's a question in the chat about, will the resources be adapted for the Calgary zone?
Great question. So if you go on the website, the success guide is there. And what you would do is you would tailor the resources to your own zone. So the success guide that's posted is generic. So it's not tailored to any specific zone right now. It's generic, and then there's only a few parts that you have to input to make it more tailored to your own zone, if that makes sense. Oh, there's another question, I think. Jane Miller? Don't know. Jane, do you want?
Yeah. Hi. Jennifer, thank you. In your presentation, you mentioned a cost of $2 billion to acute care system when malnourished patients end up staying an extra 2 or 3 days. I was just wondering, is that just Alberta or nationally?
That's nationally.
Okay.
And I do have the statistics on that if you want it. It's right on the Canadian Malnutrition Task Force website. And their website, just so you know, is called nutritioncareincanada.ca. So if you just Google nutritioncareincanada.ca,
yeah,
that's where I got that statistics, but it's a national statistic. Good question. Thank you.
Thanks so much.
Yeah.
There's another question in the chat. Who would folks connect with to train their teams on the screening tool?
Wonderful question. So first of all, I would encourage you to take a peek at the screening tool yourselves. And then if you have questions, there's 2 things you can do. You can connect directly to the email address that is inside the success guide. So there's a generic email address that all questions can go to. So you can go that route, but you can also connect locally to your public health dietitian who can help you as well set up the screening process in your community. Also, you can, if you want, you can just ask me. I'm also available because I've worked on this project a lot, and I also have lots of contact people, some who are on this call today. So that's how you can get involved. The email address in the success guide, talk to your local public health dietitian if you know them, or you can also email myself and I'll connect you. Good question. Anything else? I'll maybe take one more and then I'll let Tanya go ahead. If there's more.
I'm not seeing any right now, Jen.
Okay. I'm going to end it here, but I'm around for the rest of the presentation, and I want to happily let Tanya take over. So thank you, Tanya.
Thanks, Jen. And again, I apologize. We tried this out earlier, and of course, things always change. I'm always looking forward to the hiccup that happens with virtual webinars. So we know that food insecurity is associated with inadequate nutrient intake among Canadian adults. And so, as discussed by Jen, the nutrition screen that we are using in our success guide adds 2 questions that can really help us understand what are the barriers to food access for older adults. And so, in this section, I just want to talk more about food insecurity among older adults and move on to what might help. So first, though, I want to hear from you all. This is another Okay, here we go. People were already ahead, I think. So people are quick here. So this is an open-ended. What are you noticing around food insecurity in your communities? And so I think I'm seeing that it's on the news, common conversation. What went off the screen is that, you know, it's increasing. It's there. We're seeing the ongoing struggles. And here we can see that it's beyond food, right? People are living in their cars and still cannot afford food in people's areas. And, you know, with inflation, with costs beyond food costs rising, people are really struggling with financial strain. And with that, I'm seeing these are conversations. When I first started, there weren't as many conversations about food insecurity as I'm noticing now. And so, you know, and with the increasing concern and awareness, we're now seeing people come up with some innovative ideas, but there's just so much struggle and also so much care in our community. And people are saying we actually don't know the stories. Yeah, that even though it's common conversation, there's still so many stories to be had. And I think I've seen neighbors a few times here that people are really trying to help. And so what I'm going to talk about is what are the rates of food insecurity in Canada and in Alberta, and what is needed, what do we know is effective to address food insecurity among older adults. So I'll give a couple more seconds for you to finish any further sentences that you might be writing, to press enter, and then we'll move on. But I think there is a common theme here that I'm seeing, and really that story of financial strain and communities feeling overwhelmed and how we can help. All right, so let's look at what are the rates of food insecurity. And I think in the news, what we've heard are the rates in Canada, but also we've heard about that food banks are really experiencing increasing demand, and especially in Alberta. So Albertans access the food bank more than the national rate, and the increase of food bank use increased more than 2 times the national rate between the Food Bank Canada hunger count reports. When we look at what are the rates in Canada, so this is food bank use, and with food banks, it's estimated that only about a quarter of people who experience food insecurity will access a food bank. So then we look at what's the larger picture happening in Canada. And from the Canadian Income Survey, Proof has calculated the food insecurity rates among all the provinces. And we can see here that Alberta, not only are food banks usages above the national rates, well, that makes sense when we look at the whole picture of food insecurity in Canada, that 20.3% of Albertan households are experiencing household food insecurity. So in Alberta, that becomes 1 in 5 households. Now, this was done right when the costs of living were rising, and inflation really hit right in the middle of when this data was collected. And so Valerie Tarasik, who's the lead researcher, has said that even these rates are likely a best case scenario. So the reality is these rates are likely even higher than what this is capturing. Now, when we look at household food insecurity, oftentimes when we hear about it, we might hear about hunger, and that can be an experience of household food insecurity, but there's lots of experiences of it. And so it can be broken into 3 categories based on our measurements. There's marginal food insecurity, and that's where people are worrying about running out of food, or you know, they're limiting their selection due to a lack of money for food. There's moderate, so that's where people might start compromising the quality or the quantity of their foods because they don't have enough money for food. And then severe is where we might see missed meals, reduced food intake. And that's where some people might experience what we talk about with hunger. But food insecurity is more than that. And so at all levels, there is significant stress because there's this worry about running out of food, right? And this stress and the compromises on variety and quality of food can lead to negative health impacts at all levels. And so this is why food insecurity increases nutrition risk. Now, when we look at the rates of household food insecurity among older adults in Canada, these are the rates from the most recent Canadian income survey. So in Canada, 13.4% of individuals aged 55 to 64 live in food insecure households, and this decreases to 10.5% between the ages of 65 and 74. It further decreases to 6.1% when someone is 75 or over. So I want to know, as you see these rates, especially among older adults, how surprised are you? Are you very surprised, a bit surprised, neutral? You're a bit unsurprised, and you're not surprised at all? And just as you're responding here, the statistics are based on validated measures of household food insecurity, and I'll discuss that definition on the next slide. In Canada, the reason that we see lower rates among older adults is because they're somewhat protected through income policies. And so there's significant drops at 65 and then again at 75 due to income benefits. And so the increase of old age security leads those 75 and above to be about 3 times less likely to be food insecure than adults who are 35 to 44. Now, I think the other thing to highlight, though, is that while older adults are among the age cohort with the lowest reported rates of food insecurity in Canada, the projected increases in older population of the country suggest that the number of food insecure older adults could continue to increase if more proactive measures are not taken. As well, in Canada, the percentage of seniors who are accessing food banks has increased from 6.8% in 2019 to 8.9% in 2022. And so again, they are a protected population, but there are still some struggles happening. So what is household food insecurity? And what it is when financial strain causes inadequate or insecure access to food. And while we focus on inadequate or insecure access to food, it's not really about food itself. Rather, food insecurity is an indicator of financial strain. It's an indicator of pervasive material deprivation. So essentially, it's when the money that comes in every month isn't enough to cover all those basic needs. And that could be due to inadequate, insecure incomes and limited, if any, financial assets or access to credit. And often it's the food or it's medication that can go first because other basic needs like rent are fixed costs over the month. And so there's no wiggle room for those expenses, whereas people find that there's some wiggle room in their food. That being said, it's not a matter of budgeting. It's not a matter of learning thrifty shopping techniques because people who are experiencing household food insecurity are already doing that. They are already very thrifty shoppers. They already, there's no difference in food skills between those who experience household food insecurity and those who don't. In fact, those experiencing household food insecurity are more likely to have a food budget. And as you can see from these quotes, it's really about not having enough money. And that is the biggest barrier to healthy eating. The other thing is it's more than food. So here these quotes focus on people saying they don't have enough money for food. But when we consider all the roles that food plays in our lives, and when we consider that this is a story of financial strain, we can see that the impacts go beyond physical health. These quotes are from the Beyond Hunger report, which was a qualitative research study done across Canada. And we can see here that the impacts of food insecurity are substantial, that not only does it affect physical and mental health, but it impacts people's ability to practice their culture. It impacts their sense of social belonging and inclusion. It impacts their relationships, and it impacts their sense of meaning or purpose in life. Among adults who died prematurely, we know that those experiencing severe food insecurity died on average 9 years earlier than their food insecure counterparts. So when we go back to our case study, I thought I fixed it and I did not. So the poll will come up, but you'll see the results, I hope, on the next slide if I've done this correctly. So just going to show this. This is our case study with that Jen had gone through. And do you think this individual may experience food insecurity? We can see here that most people are saying yes. The answers were yes, no, maybe so. Let me see if it's going to work. Okay, my fix in our break did not work. So and I think the answer was kind of given because we'd asked, do you have difficulty making ends meet at the end of the month? And so that is a highly predictive that this individual is experiencing food insecurity. So the answer is yes. Now, who may be more likely to experience food insecurity among older adults? Well, I put an asterisk beside lower income categories because when research has been done to look at what factors are associated with food insecurity, sometimes when you look at some of those confounding factors, when you adjust for income, we find that sometimes some of those other factors are canceled out per se because the real reason is lower income. We also know that racialized populations, and this is in addition to income, so it kind of stands on its own. We know that racialized populations are more likely to experience food insecurity. We know Indigenous populations are more likely to experience food insecurity. And we know that people who are experiencing chronic health conditions, functional limitations, or poor mental health are also more likely to experience food insecurity while they're an older adult. The other thing to recognize is that older adults who are experiencing food insecurity may not only lack financial resources, but they also might lack physical and social resources. And that is why the nutrition screening comes in, because we can start seeing what are these barriers that older adults in our communities might be facing, and what is it that we can do in our communities to help address those barriers so that they can eat well, they can stay strong and independent as they age. So what can we do? This comes from our nutrition guideline, and it's a nutrition guideline for health professionals, but I think the key messages still are relevant to community services, community care providers. And I'm going to go through these steps about what we can do. So the first is to ask or screen. The second is to really understand what is the impact of financial strain and to work collaboratively with someone to see what sort of plan and an approach can we take. And then step 3 is to intervene and connect if the individual would like you to. So step 1. Before we get into that, I just want to know, how often do you ask people about their financial situation as part of your assessment, whether that's a formal assessment, whether that's part of an intake to any of your programs? How often do you ask? Okay, so we're seeing a range of answers here. And, screening is important because in the context of population level statistics, it might be easy to overlook food insecurity concerns among older adults who remain, again, that rapidly increasing population in Canada. And also you can't tell just by looking at someone. And so that's why it's really important to ask the question, because it also helps guide what supports will be most effective. Sometimes I like to use the analogy of illness, that it's really important to get the correct, quote, diagnosis to align the individual with the right, quote, treatment. And the same is true for community level work. If we don't accurately identify the issue, the barrier, we'll spend a lot of resources working on the wrong intervention. And so if we can screen for financial strain and we know that it is a major barrier to eating well, then that helps guide us to what we can do. So we want to start the conversation by asking for permission and for normalizing it. And this is outlined on the screen itself. Again, I apologize for my slides not working. They worked yesterday, but on the screen itself, it actually guides you to that. And I think actually what I'm going to do so that you can see it, because I find myself that I like to see things, is I'm just going to I'm going to work on pulling it up here. Okay. And we'll go back and see if this will work for us. No, it's not going to let us go back, but okay, we're going to do something else. You're going to see my slides this way for a second. So I wanted to show you this question here because the screen itself actually leads into that permission conversation. And so you can see here that it's normalizing at first. So you ask how much money, you state how much money you have to buy food affects your nutrition. Is it okay if I ask you about your financial situation? And if they say no, then you move on. If they say yes, then you ask this question, which is a validated question that says, do you ever have difficulty making ends meet at the end of the month? And then they can answer yes or no. Now, the other question that we ask for older adults, because again, we know that physical barriers can be another barrier to food access, is that we normalize the question about when physical mobility and transports are limited, it can be hard to get healthy foods. Do you have difficulty getting your groceries? And I guess, again, they can answer yes or no. Now, with this question here, do you ever have difficulty making ends meet at the end of the month? Sometimes this is the validated question. This is the one we recommend that you start with. But sometimes there might be, people might not understand what you mean by this. And so you may have to follow it up with some additional questions. Which can be, do you have difficulty paying your bills at the end of the month? Do you have difficulty with any of the recommended health services or any of the recommendations that you've had from any health professionals because you don't have enough money? Or something like, is it ever hard to make your money last until the end of the month or your next payday? So that's the first thing we want to do is ask or screen. And then in order for us to really know how can we best support individuals, then we want to go on to really understanding and assessing what is the impact of that financial strain. And that's really about just hearing their response. Right. And so, for example, you might hear that it's not just food, but it's other needs, and they're experiencing some other barriers. And so in that way, you can start connecting individuals with those better resources. And so, for example, you may hear about physical limitations, such as mobility issues, and then you can work to address these barriers in the next step. For example, pairing free transportation with services, or finding programs that give gift cards versus food hampers for more flexibility to personal needs. And the wayfinding tool that Jen had shown, and I'm going to just show it again on the next slide, is really meant to be a collaborative conversation with individuals so you can provide them with tailored resources and connections. So the third step, I'm just going to skip this because the polls are okay, we're just going to adapt and go with this. I apologize. We're going to show my slides this way. I apologize, not the most user-friendly, but you can see them this way at least. So our next step is to look at this wayfinding tool. And so what the tool does is it actually prioritizes, it's a risk priority. And you can see that question 9 and 10 are higher priority questions. And you can see here that there on the wayfinding tool, there are community services and healthcare referrals that are listed here. But I want to point out that right here on the wayfinding tool, it highlights how helping clients access additional financial assistance is the best way to help clients preserve their dignity, their agency, and their choice to meet their food needs. Okay. So I am going to launch this poll. And so I'm just curious, what are some things that you might offer? So if someone answers yes to difficulty accessing groceries, so they're experiencing some physical barriers, but also understanding that financial barriers might be still underlying that, what resources could you offer? And so this is a word cloud. And so if you use a tilde, I think it's called, but that little squiggly line between multiple words, you can put in your responses. And just in the chat, are the polls still working? Is it just my slides that aren't working? Okay, the poll works. It's just not showing the results. My goodness. Let's see. Yeah, so technical, I always say technical difficulties, doesn't matter how prepared you are. I've done this many times. It has never been an issue, but today it is apparently an issue. So I apologize. I still ask that you put in the information again. Can you provide the QR code again? If you can someone type in the web page again. It's pollev.com. Tanya LaRue 351 is how to get to the polls. I'm just going to skip ahead again. I just wanted to kind of see where you're at and kind of talk about what resources we can connect to. So what resources can we connect to? I did see when people were introducing themselves that there were people from Meals on Wheels programs. Thanks, Cheryl, for putting that in. That poll will be up still, so you can continue to put in your responses. It does help me after because I do tend to look at them and see what is happening in our community. So again, I apologize for that, or feel free to put them in the chat as we go. But what resources can we connect to? And I think it's really important to acknowledge the care and the compassion that takes place in our communities. Often programs are started and they're done with the best intentions. They're driven by the messaging around food insecurity around us. And I think it's really important to highlight what community approaches can do and what they do not do so that we can continue to adjust our programs to ensure that we're meeting people's needs. So what we do know is for people who are experiencing physical barriers, home delivered programs may have some beneficial effects on the nutrition status of older adults in community. And their effectiveness can be further enhanced by including older adults' perspectives in program design, implementation, and evaluation. And it's really important, though, to note that there are several types of home delivered meal services existing, which can vary in how they operate, what they offer, and who can access them. Generally, they're eligible for individuals unable to access food due to an inability to provide their own meals and limited mobility. So those physical barriers. And these might be a beneficial thing to recommend to those who are screening for difficulty accessing groceries. You'll notice I put a but. And so the reason I put a but is that if the main barrier is financial strain, then food-based programs are not effective. Food programs such as collective kitchens and community gardens are sometimes another popular approach to address household food insecurity. And I think I saw that in some of the answers. And while these do provide opportunities for stronger social support networks, so again, they might help address some of those social barriers that people may be experiencing. They might provide opportunities to be physically active, especially like thinking about a community garden, and they might allow individuals to experiment with gardening and cooking. In the context of financial strain and household food insecurity, they do not protect against financial constraints. And research shows that any impact on nutrition intake, so for example, increasing vegetable and fruit, are small and transient. So the other thing is they often have lower participation rates by those who are experiencing household food insecurity due to reasons relating to accessibility. The other thing that we found in some of our research reviews is that while access to transportation may be important for physical barriers, in our literature review about the built food environment and nutrition risk among older adults, some research suggests that older adults did not want to spend money for cab fare or grocery delivery to get groceries. And so I did notice that in the chat, there's volunteers who help with grocery shopping. And I know that there's other programs and communities that do grocery delivery for free. And so something to consider is that if there is another element of financial strain, some of these services in the community might not be accessible to everyone. Now, food banks is another common resource that we use in our community. And we know that food bank usage has increased. But we also know that they're ineffective to address food insecurity Where they play a role is that they can provide the necessary emergency provisions and subsequent relief when a family or an individual is in a crisis at that specific time. But they were never meant to be a long-term solution. And food banks themselves have said that, right? Rather, they were meant to be as a stopgap. But now it's become where society has come to depend on them. And again, this service may be important in instances of immediate needs. The overall food provisions don't address the root of household food insecurity. It's also important to know the realities. So this picture here is an example of what is included in a hamper. And when we think about, even our case study, and we think about how easy would it be for our individual to use some of these foods, we have to really think about, are they really appropriate? We know that much of the food in food bank hampers can go to waste. There's some reports estimating that 60 to 90% of what's in a food hamper might not actually be used by that individual because they cannot use it. It doesn't fit their dietary needs. It doesn't fit their cultural needs. It doesn't fit their preferences. And so sometimes there's a disconnect between what people living in food insecure households need and what food banks, through their best intentions, are able to provide. Again, with great effort. The other thing is to consider is the realities of even getting that assistance, right? And so if you're talking to someone who does want access to the food bank, sometimes assisting with the referral process can be helpful because it can be quite daunting. And also looking at what are some other barriers. Are they able to get to the food bank, right? This was a Kijiji post where you can see that, someone is trying to get to the food bank, but they just can't because of their transportation. And so they're trying to do some food exchange in order to get a ride. And so, again, it's just recognizing that food banks are there, but they aren't effective in addressing food insecurity. What can we do? I think it's really important to even think about if we do offer food banks, offer in conjunction with resources to address financial strain, right? You can, if you're not familiar with your local food bank, you can understand what is in your local food bank hamper. You can understand the eligibility requirements. You can share that information with the individuals you're helping. If your program offers food hampers or food care packages, might want to consider ways to address any access barriers. May want to consider if there's ways to offer more choice or equity. So finding ways to offer choice of food, offer more expensive food, such as vouchers for perishable foods or other basic needs. Or it's looking at, can we transform our food hamper program into gift cards? And so this research is for ICANN for Kids out of Calgary, which was a food hamper program that then converted to a targeted gift card program. And they did research that shows that doing this swap was beneficial for both the individuals receiving the gift card, as well as for agencies who were given the gift card. There was also benefits to donors because the gift cards were being used. There was less potential food waste that happens. And so it's something to consider. Can you swap food hamper programs to gift cards? Can you supplement? If you can't do the full swap, is there a way to supplement food hampers with gift cards? It's also looking at beyond food. And so the, ignore the poll that's there. When we look at reducing the financial strain in communities, the RIFS project and now program at Alberta Health Services has a building financial well-being community planning toolkit, which offers a lot of approaches that communities can take to address financial strain. And so some of them include, looking at even system navigation and access. Sometimes certain services are only available during certain hours, but if someone is working, they don't have sick time, they might be losing money in order to access that service. And so offering some of those flexible hours for service can lead to no loss in income. And it also can lead to more likelihood that that individual can attend that service. Another thing is looking at events and attractions, remembering that food insecurity has a significant impact on sense of belonging. And I said food insecurity has that impact, but really it's financial strain. And so looking at, can there be free or subsidized or discounted fees to access services and events within your community so that more income is available for food, and so that there is a way for people to be included in those in that social gathering and build or reinforce a sense of belonging. For transportation, this poll is going to be in the way, but it's the same idea, right? Looking at, are there discounted, subsidized taxi services or public transportation, or are there volunteer programs that can offer transportation to different groups? And what's behind the poll is the same thing, is that this leads more income available for other essential needs, and it allows access to services, it allows access into the community. And so overall, when we look at addressing financial strain, then it gets to more of that root cause of food insecurity. And it helps it helps address really that biggest barrier. So what percentage, and you could put that, we're not going to see everyone's responses here, but just curious, what percentage do you think Canadians, what percentage of Canadians do you think file their income tax every year? So the choices that should be up on the screen but aren't here are 4 to 6%, 7 to 9%, 10 to 12%, or 13 to 15%. And let me know, I could see more if I want. Oh, here we go. So I can show us here. So we can see that some people have said 7 to 9%, some people have said 10 to 12%, and some people have said 13 to 15%, and no one has said none of the above. So what we know from recent research is that it is actually 10 to 12% of Canadians do not file their income tax every year. Why this is important is that we cannot access federal and provincial benefits without having taxes filed. So another really important strategy is having free tax clinics in your communities and opening them up for older adults as well as people experiencing financial strain. Okay. So here too, when we think about addressing financial strain, I think that it's really linking them to benefit navigation. So on the wayfinding tool, Alberta 211 is there. As I mentioned, free income tax filing clinics. A lot of our local family and community support services have different programs or different ways to help navigate that, or at least they're informed of resources that can help. And so it's really thinking about who can you connect this individual with that can help them address that financial strain? And so just curious, how confident, when we think about our individual, our 73-year-old woman, how confident do you feel that you could support her with her food insecurity and or with her food access barriers? So I'm seeing that most people are feeling somewhat confident. There's neutral here, and I just went ahead. Sorry about that. I have some people feeling not confident. And so a mix of answers. And I think, again, a lot of this can happen through ensuring that we're having these conversations in our communities. And I think it's as we work on the nutrition screening, as we look at the wayfinding tool, we can become more familiar with different resources that are in our community. I think at the end of the day, what we know is the most effective response to address food insecurity is income-based policies, especially income-based policies and benefits that are indexed to cost of living. And while policy change might be beyond what our personal capacities are, we can still do great work towards policy changes and towards our different programs in our communities by having these conversations that food insecurity isn't really about food, that it is truly about the barriers that it is, and the biggest barrier is financial strain. And so I encourage you to have conversations that help reflect this understanding. We can keep planting seeds, we can keep being innovative in our communities to do the best that we can to inform any poverty reduction or financial strain efforts in your community. And so I think, leaving today for the programs you're part of, important questions to leave with is, does this approach address the root causes of income inadequacy? Does this approach preserve dignity? Does it reduce stigma or prevent stigma? And does it consider the lived experiences of the older adults that you are supporting? And does it consider the unique financial, physical, and social situations of the older adults you support, which I think the nutrition screening tools can help us with that. So I'm just going to skip through this because, again, my slides did their own thing overnight. But I just wanted to remind us that we're in this together, that I think supporting older adults' food security is more than simply food, that nutrition screening is one way to support older adults' food security and really address their food insecurity and help us work towards moving beyond simply food to consider the financial, the physical, and the social environments needed to support older adults. So thank you for staying with me with this. You will get the slides mailed to you. There are a lot of resources that are in the slides, but I think I'm just going to stop and be able to see the chat again. And just, I want you, as we leave today, just think about, has anything shifted for you? What's one thing you might take away? And also, are there any supports that might help you continue to have these conversations in communities? But I'm going to stop my share so that I can see the questions, and I'm open to taking any questions. And again, I am so sorry that technology was not on my side today. So I appreciate your cooperation as I tried to navigate through that. And Jasmine, I might need some help to navigate too, as I have 3 monitors open. I don't know where to look.
You bet. Folks are just saying how much they appreciate you driving home, that it's about a lack of financial resources and not about a lack of food. Which, as somebody who's very involved in food security related things, it's so important for us to hear that over and over and over again, because it really helps to shift people's mindsets around food insecurity. There's a question about, is there any collaboration with the Alberta Seniors Special Needs Assistance Program?
That's a great question. Sorry, Tanya.
Yeah, go ahead, Jen. I was going to ask you.
As of right now, there isn't, but that's a really good conversation we could probably have in the future. I've had to deal with them for other issues, dealing with my one-on-one clients, but not yet. But thanks for that little spark that's put in me. Thank you.
Yeah, I see here a comment that $3,118 per year is being funded for ONS.
Yeah, it's $2.16 a bottle that clients can get, up to 4 bottles a day if they qualify. So that's a good thing to know.
Yeah, and if there's any questions, again, with the resources, as I wait for questions to come in, because I know myself, it takes me a while to think and then I start typing and then I don't get them out. But I was just going to highlight some of the resources that we do have, that we do highlight are where to find the nutrition screening resources. So that's where you can find those blank templates for the wayfinding tool. There's also included a link for resources for older adults, which has some healthy eating fact sheets for older adults. So if they're wanting to learn more about food and nutrition and you have a conversation with them, we've included a link to Proof, which includes fact sheets and research on household food insecurity in Canada, some great videos as well, and some great fact sheets that really show the information. We've included the RIFs project that I mentioned, and so there's some stories there, video stories of people who have experienced financial strain. There's also, like I said, that Building Financial Wellbeing Community Planning Toolkit, which has great practical things that communities can do. And so if you're wondering, if not food, then what? I recommend that that's a place to start. And then we've included our food insecurity page with AHS, which also has evidence. We're continuing to add to it to just help inform communities. How can we better address household food insecurity? So those are there. We've included some navigation support resources as well. And so you'll have that, and I think we'll ensure the hyperlinks work. And someone else is looking after it, so I'm not. I thought my polls would work today, and they didn't. So again, I'm just seeing if there's any other questions that came in.
Maybe as you're looking for that, Tanya, if it's okay, I'll share our last couple of slides, if that's okay. So we will send all of the slides to everyone following, and we'll make sure that there's links to everything that was referenced. So it'll take, just give us till the end of the week. I want to make sure that what we send you out is, you're able to click on the links and access all of the materials from one place. So just give us a bit of time for that. I wanted to conclude today also by sharing with you some other opportunities for engaging with Healthy Aging Alberta. So one is Core Alberta, which I'm assuming a lot of you are on the mailing list, because that might have been how you heard about today's webinar. And there's an opportunity for you to get involved around some shared priorities on a regional and provincial level that would inform policy change, and food security and income is really, an important part of that. Engagement through the position paper development that Healthy Aging Alberta is working on. Again, that's around advocacy. Engagement with the application of the Healthy Aging Framework, which has addresses food security as a part of it. And then one of the last things I wanted to share with you is an in-person opportunity to gather, and I've put a link in the chat. So Healthy Aging Alberta is hosting regional gatherings across the province. Our first one is going to be in Lethbridge, and you can see here April 25th. So these gatherings are all over the province. If you are interested in connecting with us, I can put our email address in the chat, which is info@healthyagingalberta.ca. So I also put a link in the chat to register for the regional gatherings. So if you're interested in learning more about what we're doing, and also when I send out the slides, I'll make sure that our contact information is in there as well. And then lastly, we would just really like to thank you for participating today. We are going to be sending a survey out along with the link to the YouTube video from our recording, as well as to all of the slides. So please complete the survey and let us know what you thought. You can continue to check us out on Core Alberta at corealberta.ca and connect with us at info@healthyagingalberta.ca. So thanks. I'm not seeing any more questions. So if there's anything else, we'll still stay on for a couple more minutes and I'll stop sharing. And so if there's anything else, we would still love to hear from you. But thanks for joining us today. What I will do though, is I will stop recording.